How are genes linked to osteoporosis in men? Imagine your bones as a sturdy framework that keeps you upright and active. For some men, their genetic makeup can influence how strong or fragile that framework becomes over time. Genetics play a big role in osteoporosis in men by affecting bone mineral density, which is how dense and strong your bones are. Studies show that up to 80% of the differences in bone density among men can be explained by genetics. This means that many men inherit genes that influence their bone health and their risk of developing osteoporosis. Scientists have identified specific genes linked to bone health. For example, the gene called BMP2 helps in forming bones and cartilage. Others, like the vitamin D receptor gene, which helps your body use vitamin D to absorb calcium, are also important. Genes related to estrogen receptors, even in men, can influence bone strength because estrogen is involved in bone maintenance. The COL1A1 gene makes collagen, a key part of bone structure, and variations here can affect bone quality. Recent research has also found new genes, such as DOM2 and RUNX1, that might be involved in severe or unexplained cases of osteoporosis, especially in younger men who develop it without clear reasons. Genetic influences on osteoporosis can also be specific to certain parts of the skeleton. For example, some genes may affect the bones in your hips more than those in your spine. Additionally, genetics interact with hormones like testosterone, which is vital for maintaining bone strength in men. When testosterone levels are low, whether due to aging or inherited factors, bones can weaken, increasing the risk of osteoporosis. While you can't change your genes, understanding your family history can help identify if you are at higher risk. If osteoporosis runs in your family, especially on your mother's side, it's a good idea to discuss this with your healthcare provider. Besides genetics, lifestyle factors like smoking, alcohol use, and certain medical conditions also influence your bone health. Combining genetic predisposition with these modifiable factors determines your overall risk. In summary, genes linked to osteoporosis in men influence bone density and structure through various pathways, including bone formation, hormone regulation, and bone remodeling. Knowing about these genetic factors can help doctors identify men who might be at higher risk early on. This knowledge allows for better prevention strategies and targeted treatments to help maintain strong bones and reduce fracture risk. Always remember, individual health varies, so it's important to consult healthcare professionals for personalized advice and care.